Can Britain teach us anything about dealing with drug addicts? That remains to be seen, but one thing seems certain: there's little or nothing we can teach them. They tried our hardline methods back in the 70s and 80s, and all they got for their trouble was more drugs, more crime, and more addicts. So they went back to their way, letting doctors prescribe whatever drug a particular addict was hooked on. Does it work? If they're ever going to know, Liverpool, where drugs are out of control, is the place to find out. This is a gram of 100% pure heroin. It's pharmaceutically prepared. On the streets, it would be cut 10 to 15 times and sell for about $2,000. But take it away from the black market, make it legal, and heroin's a pretty cheap drug. The British National Health Service pays about $10 for this gram of heroin. And for an addict with a prescription, it's free. In Britain, doctors who hold a special license from the government are allowed to prescribe hard drugs to addicts. Dr. John Marks, a psychiatrist who runs an addiction clinic just outside Liverpool, has been prescribing heroin for years.
If their drug taker is determined to continue their drug use, treating them is an expensive waste of time. And really the choice that I'm being offered and society is being offered is drugs from the clinic or drugs from the mafia.
To get drugs from the clinic rather than from the mafia, addicts have to take a urine test to prove they're taking the drugs they say they are. And unlike most other addiction clinics where you have to say you want to kick the habit before they'll take you in, addicts here have to convince Dr. Marks, a nurse, and a social worker that they intend to stay on drugs come what may. But doesn't Dr. Marks try to cure people?
Cure people? No. Nobody can. Regardless of whether you stick them in prison, put them in mental hospitals and give them electric shocks. We've done all these things. Put them in a nice rehab centre away in the country. Give them a social worker, pat them on the head. Give them drugs. Give them no drugs. Doesn't matter what you do. 5% per annum, 1 in 20 per year, get off spontaneously. Compound interested up, that reaches about 50%, 50-50 after 10 years, are off. They seem to mature out of addiction regardless of any intervention in the interim. But you can keep them alive and healthy and legal during that 10 years, if you so wish to.
By giving them drugs?
It doesn't get them off drugs. It doesn't prolong their addiction either. But it stops them offending, it keeps them healthy, and it keeps them alive.
That's exactly what happened to Julia Scott. Although she doesn't look it, Julia is a heroin addict. For the last 3 years, the heroin she injects every day comes through a prescription. Before, she had to feed her habit by working as a prostitute. A vicious circle that led her to use more heroin to cope with that life.
And once you get in that circle, you can't get out. And I didn't think I was ever going to get out.
But once you got the prescription?
I stopped straight away.
Never went back?
No, never. I went back once just to see, and I was almost physically sick. Just to see these girls doing what I used to do.
Julia says she's now able to have normal relationships, to hold down a job as a waitress, and to care for her 3-year-old daughter. Without that prescription, where do you think you'd be today?
I'd probably be dead by now.
Okay. Okay. 160 then.
If I can, yeah.
Of heroin.
Once they've got their prescriptions, addicts must show up for regular meetings to show they're staying healthy and free from crime. But how can anyone be healthy if they're taking a drug like heroin?
Pure heroin is not dangerous. We have people on massive doses of heroin.
Alan Parry is a former drug information officer for the local health authority and now a counselor at the clinic. So how come we see so much damage caused by heroin?
The heroin that is causing that damage is not causing damage because of the heroin in it. It's causing the damage because of brick dust in it, coffee, crushed bleach crystals, anything. That causes the harm. And if heroin is 90% adulterated, that means only 10% heroin, the rest is rubbish. Now, you inject cement into your veins, and you don't have to be a medical expert to work out that's going to cause harm. OK, George, let's just put your leg up. Let's have a look.
Many at the clinic, like George, still suffer from the damage caused by street drugs. Alan Perry believes you can't prescribe clean drugs and needles to addicts without teaching them how to use them.
The other major cause of ill health to drug injectors is not even the dirty drugs they take. It's their bad technique, not knowing how to do it. I've seen drug users in the States with missing legs and arms, and that is through bad technique. Can we have a look at your arms? Have you been...
George's legs have ulcerated and the veins in his arms have collapsed. To inject, he must use a vein in his groin, which is dangerously close to an artery.
Now, when you go in there, you get any sharp pains?
No.
If you hit the artery, how would you recognize it?
If I hit the artery?
Yeah.
By my head hitting the ceiling.
So we show people how to, not how to inject safely, but how to inject less dangerously. We have to be clear about that. You know, stone people sticking needles in themselves is a dangerous activity. But the strategy is called harm minimization.
In the 70s, the British weren't content with minimizing the harm of drug abuse. They adopted the American policy of trying to stamp it out altogether. Prescription drugs were no longer widely available, and addicts who couldn't kick the habit had to find illegal sources. The result? By the end of the 80s, drug addiction in Britain had tripled. In Liverpool, there was so much heroin around, it was known as Smack City. And then came a greater threat. More than anything else, it's been the threat of AIDS that has persuaded the British to return to their old policy of maintaining addicts on their drug of choice. In New York, it's estimated that more than half of those who inject drugs have contracted the AIDS virus through swapping contaminated needles. Here in Liverpool, the comparable number, the number of known addicts infected, is less than 1%. In an effort to get addicts away from injecting, Liverpool pharmacist Jeremy Clitheroe has developed what he calls heroin reefers. They're regular cigarettes with heroin in them. Whatever you feel about smoking, he says, these cigarettes hold fewer risks than needles for both the addicts and the community.
So we then use this to put in a known volume of pharmaceutical heroin into the patient's cigarette. And there we are, one heroin reefer containing exactly 60 milligrams of pharmaceutical heroin.
So the National Health Service will pay for the heroin, but not for the cigarettes?
Oh, yes, yes, of course. It's the patient's own cigarette, but with the National Health prescription put into it.
Addicts pick up their prescription twice a week from his neighborhood pharmacy. And how does this affect his other customers?
Oh, don't you worry, thank you very much. The patient who comes in to pick up a prescription of heroin in the form of reefers would be indistinguishable from a patient who picks up any other medication. Bye-bye. Hello, Paul, how are you doing?
Fine.
All right.
Cigarettes next week?
Smashing. Anything else we can do for you?
No, it's fine now.
The prescription is ready and waiting, and they pick it up just as they would pick up their paracetamol, aspirin, or bandages.
With all of these drugs available to most people, plus the hard drugs that you have here, what's your security like?
Like Fort Knox. But we keep minimal stocks. We buy the stuff in regularly, frequently. Comes in, goes out.
And heroin isn't the only stuff to come in and out of here. Clitheroe also fills prescriptions for cocaine, and that's 100% pure, freebase cocaine. In other words, crack.
So, in fact, when you're putting cocaine in here,
Yes.
You're actually making crack cigarettes?
Yes.
In America, that has a very negative connotation, but not for you.
Depends which way you look at it. If they continue to buy on the street, whether it's heroin, methadone, crack, or whatever, sooner or later they will suffer from the merchandise that they're buying. I want to bring them into contact with the system, and let's give them their drug of choice, if the physician agrees and prescribes it, in a form which won't cause their health such awful deterioration.
And you don't have any problems giving people injectable cocaine or cocaine cigarettes?
No. Not in principle. I mean, there are patients to whom I prescribe cocaine and to whom I've then stopped prescribing the cocaine because their lives do not stabilize. They continue to be thieves or whatever.
But there are equally many more to whom we've prescribed cocaine who have then settled to regular, sensible lives.
Mike Lithgow is one of those who has settled into a regular, sensible life on cocaine. He has a prescription from Dr. Marks for both the cocaine spray and the cocaine cigarettes. Before he got that prescription, the cocaine he bought on the street cost him $1,000 a week, which at first he managed to take from his own business. But it wasn't long before it cost him much more than that.
So you lost your business?
Yeah.
You lost your wife?
Yeah.
You lost the kids?
Yeah.
And the house?
Yeah.
But you kept going after the cocaine?
Yeah. That's what addiction is. That's the very nature of addiction, is the fact that one is virtually chemically and physically forced to continue that way.
Now, after 2 years of controlled use on prescription cocaine, Mike has voluntarily reduced his dose. He's got himself a regular job with a trucking company and is slowly putting his life back together again.
Where do you think you would be now if Dr. Marks had not given you a prescription for cocaine?
I wouldn't be here now talking to you. And you probably wouldn't be interested in talking to me either. I'd be on the street.
Dr. Marks, how would you reply to critics who would say that you're nothing more than a legalized dealer, a pusher?
I'd agree. That's what the state of England arranges, that there's a legal, controlled supply of drugs. The whole concept behind this is control.
And there are signs that control is working. Within the area of the clinic, Alan Parry says the police have reported a significant drop in drug-related crime. And since addicts don't have to deal anymore to support their habit, they're not recruiting new customers, so far fewer new people are being turned on to drugs.
What do the dealers around the area of the clinic think about it all?
Well, there aren't any around the clinic.
You've taken away their business.
Exactly. There's no business there. The scene is disappearing. So if you want to get rid of your drug problem, which presumably all societies do, there are ways of doing it. But you have to counter your own moral and political prejudice.
What would you say to people who would ask, why give addicts what they want? Why give them drugs?
So they can live, so they have a chance to live like everyone else does. No one would hesitate to give other sorts of maintaining drugs to diabetics. Diabetics have insulin. In my mind, it's no different. It's the same. I need heroin to live.
If you've ever